A very good evening to you and a warm welcome to the main news bulletin tonight. I am Agatha Egwaruju. 91 new cases of coronavirus have been reported by the Nigeria Center for Disease Control (NCDC), bringing the number of confirmed cases in the country to 1,273. A breakdown indicates that Lagos has 43, Sokoto 8, Taraba 6, Kaduna and Gombe 5 each. Oyo, FCT, Edo, Ondo, Rivers and Bauchi have 3 cases each. Others are Osun with 2 cases and Akwa Ibom, Bayelsa, Ebonyi and Kebbi 1 case each. As at 11:50 Sunday night, 239 patients have been discharged and 40 deaths recorded. Now, President Muhammadu Buhari will address the nation at 8 o'clock this evening. A statement by his special advisor on media, Femi Adesina, enjoins television, radio, and other electronic media stations to hook up to the network services of the NTA and the Federal Radio Corporation of Nigeria, FRCN, respectively, for the broadcasts. Edo State government has provided an alternative source of learning for children in the state during this period of partial lockdown. It is called Edo Best at Home. Governor Godwin Obaseki announced the official commencement of the program. He says it is carefully packaged to address the education needs of every Edo child this period. Goodluck Enaini reports.
Schools in Edo State were closed late last term to check the spread of coronavirus. Ordinarily, schools ought to resume for the 3rd term on the 27th of April, and from all indications, there is little hope of this happening anytime soon. This is why the state government has deployed the Edo Best at Home initiative, an adapted online version of the Edo Best School Learning Program, which the state government introduced 2 years ago to provide daily lessons on the SUBEB website. Edo Best at Home is comprised of interactive audio lessons with customized messaging, digital self-studies activities packed, digital storybooks, and virtually moderated teachers and student classroom interaction. The module is designed to offer up to 4 hours of learning daily, and its content will be available, and children can access the day's lesson at any time throughout the day. Government has made provisions to accommodate parents regardless of their financial status.
We are partnering with MTN to provide zero data access and two-way SMS at no cost to parents. Also, for those parents with basic feature or analog phones, daily content will be delivered through USSD and audio files.
Children with special needs are not left out under the arrangement.
We are going to distribute care packs of non-perishable food items and appropriate educational materials to parents and guardians of special needs pupils and students across the state. We already have plans to stay in touch with their parents and guardians throughout the period of partial lockdown.
The governor urges parents and operators of private schools to key into the initiative at no cost. In Benin, Goodluck Enaini, NTA News.
The Central Hospital Benin is fully functional and open to the public. Commissioner for Health, Dr. Patrick Okundia, stated this in an interview with NTA News, where he also explained why the hospital was closed for 24 hours. Goodluck Enaini reports that he also spoke on the increase in the number of COVID-19 confirmed cases recorded by the NCDC.
Dr. Okundia, who is reacting to a video circulating in the social media on the alleged closure of the General Outpatient Department and Accident and Emergency Section of the hospital, explained that a confirmed case of COVID-19 was recorded on the 23rd of this month, and that the patient happened to be a staff of the Hospital Management Board. He visited the Accident and Emergency and General Patient Department of the hospital, where doctors started him on treatment but later referred him to the isolation center at the Stella Obasanjo Hospital, having tested positive. This raised a level of apprehension amongst hospital staff, hence the closure and the contamination of the two sections were promptly ordered.
For services to still go on, they had to relocate all the facilities there and move them to another area for the general patient department to run, and the accident emergency that was now relocated to the back of that facility. I believe our dear lady got there and there was a period where there was nobody around. But I think should have just asked some questions, that place was already being decontaminated. And so he did not expect any staff of HMB to still be there to attend. And no patient actually went there.
The commissioner, who attributed the increase of the number of confirmed cases of COVID-19 in the state to the ongoing screening and testing, is indeed hopeful.
We are taking these exercises down to them with the fixed screening centers and the mobile screening centers. So that has generated a lot of responses from the people, and a lot of samples have been sent. So if you look at the past just few days, we were able to get about 25 samples. It's out of that 25, we have 3 confirmed cases.
He wants the citizens not to entertain fears, as government is committed to their safety. In Benin, Goodluck Enaini, NTA News.
Now, health workers are at the front line of the COVID-19 outbreak response, and as such are constantly at risk of coronavirus, especially as the number of confirmed cases are on the increase in the country. Anwuli Okolo spoke with some medical practitioners on the evolving numbers and precautionary measures available for health workers.
Healthcare workers have so far been affected with the virus, with most of them being doctors, 2 of whom have died in Lagos and Katsina. This was confirmed by the Minister of Health, Dr. Saige Hanuri, during one of the PTF's briefing on COVID-19. These statistics will hit hard at the already inadequate number of medical personnel available in the country. The medical personnel in the COVID-19 task force are not just at risk now, but health practitioners say that at this stage of community transmission of the disease, almost every health worker is at risk of the virus, especially in communities with poor healthcare facilities.
They should try to get us at least disposable PPE so that we can wear, because some of the patients are asymptomatic.
One of these medical personnel in the front lines is Dr. Ben Okwara. His concern is not just infection and deaths now, but the adverse effect the pandemic is going to have on the mental health of medical practitioners.
You see a situation where it's the same set of people seeing the same patients and more patients, and they keep walking and walking. At the end of the day, psychologically, they are traumatized because they catch little or no sleep. They are practically almost separated from their family, if you understand what I mean. They get home, but they are not mixing up with their family. So it's also recommended that psychologists, psychotherapists should actually be talking not just to the patients, but also to the healthcare workers.
Apart from providing protective kits and safety equipments, the federal and state governments recently approved special allowances for doctors directly in the front lines of fighting against the virus. As health workers are commended for their services to humanity during this pandemic, they in turn are urging every member of the public to reduce their risks by taking responsibility and abide to all COVID-19 precautionary measures, which include the stay-at-home order, use of face mask, constant hand washing, and social distancing precautions. In Benin, Anwuli Okolo, NTA News.
And in the studio, I have a nurse with the University of Benin Teaching Hospital, UBTH, Dr. Osigbeme Augustine. Yeah, a nurse with the UBTH, Osigbeme Augustine. He's a member of the Rapid Response Team, and he works in the isolation unit of the hospital. Nurse, you're welcome.
Thank you very much. I'm a nurse.
All right.
Nurse, Osigbeme Augustine.
All right.
Yeah.
Now, you deal directly with COVID-19 patients.
Yes, of course.
Can you share your experience with us?
Okay, the experience with these patients is about the same with every other patient, except that we limit contact with them. Everybody in the world today know that the virus is very, very contagious. So what you do is, if you do not have anything to do in their own area, you don't go there. You must have something to do there before you go there. And going in there means that you must be completely suited up in the hazmat suit. You know, N95 mask, goggles, the suit itself, like an overall with a hood, covers your head to your face, all parts of your body covered up. So you go in there, do what you want to do, max 10-15 minutes, you are out of the place. Then there's a skill for pulling off the hazmat suit. You pull it off, then you go, decontaminate your hand, and you continue. And so it's different. Now, the reason you see contamination among health workers is because a lot of the times patients come to the hospital, they don't tell you the truth. They don't tell you the truth. You know, they come to the hospital, a man that had been told that he had a problem will come and pretend as if he never had any problem. So you will attend to the person, clamp the person normally, and you are exposed. Now, and also, when this patient comes in, a man may be asymptomatic. He may come for something else, but he has COVID. So it calls for us now to be a little bit much more cautious. Because right now, everybody in the street is a suspected COVID patient. Everybody. I have a headache, I have cough, I have this, I have that. It's a suspected COVID because people don't tell the truth. They even go to the screening center, they don't tell the truth. They come to the hospital, a lot of people don't tell the truth. So that's why you have that level of exposure. But today, the health workers are wiser. So irrespective of who you are, they treat you as a COVID patient until proven otherwise.
Okay.
Yeah.
Now there are restrictions in place, but we are seeing every day Edo is recorded quite a number of cases. What would you say about that, despite restrictions already in place?
I think the high number of cases is dependent on the fact that you now do more testing. And because if you don't do tests, you won't know if anybody has COVID or not. That's number one. Then number two is the fact that there are restrictions in place. There's a partial lockdown, but how obedient are we to the laid down rules and regulation by government? Just take a stroll around town. Majority of people don't wear masks, and even when they have their mask on, they draw it down to their chin, or in a funny way, they don't wear mask. Majority don't wash their hands. Some would say it's a big man's disease, but don't forget, if it's a big man disease, the poor man is the big man's driver. The poor man is the big man's megad. The poor man is the big man's dry cleaner. The poor man is the big man anything. So if a big man comes to you as a poor man and offers his hand, won't you shake the hand? You will shake the hand. So the poor man has to protect himself as much as the big man has to protect himself. Because if the big man has protected himself and does not protect his gardener, he does not see that his gardener, his megad, his cook, they are protected, the cook can bring it to his house. So if the big man is protecting himself, the big man should also ensure that the poor people around him are protected. And if the poor man is protecting himself, he should also try to make sure that the big man around him is protected. And that's the way it goes. Look, today we are talking about community transmission in Edo State, yes, or in the whole of Nigeria. Why are we having community transmission? Because people that had it went to the community and mixed up. Some people even knew they had COVID-19, and they started holding high-profile meetings with high-profile people. A case was recorded in the news about an ambassador in Kano who had COVID. He knew, but he decided to be holding meetings and contracting people, infecting people, and at the end of the day, a lot of people got infected through him.
Okay. Now, as a nurse, what would be your special appeal to people at this point?
My special appeal to everybody: please protect yourself. To wash hand is not difficult, honestly. To wear this face mask is not difficult, honestly. To keep away respectable distance is not difficult, honestly. You know, to obey rules and regulations. That's the problem that we have. People don't obey rules and regulations. You go to Lagos as if nothing is happening.
You go to mission road as if nothing is happening. And when you look at the reality of what you know from a little study you have made, what you know from things you have seen, you begin to wonder. Now, if countries like America, Spain, Italy, Britain cannot deal with COVID-19, Nigeria cannot deal with it. And that's why I want to appeal to everybody, all our fathers, all our mothers, all our wives, all our children, to please take this simple precaution. Wear your mask, wash your hands, don't mix with crowd, you know, and every other thing that the government has said. Let's just do them. Stay in your house, don't go to the field and play football, stay at home. It will help limit the spread of COVID virus.
All right. Thank you so much, Nurse Augustine, for your time.
Thank you very much.
All right, we've been speaking with Nurse Osigbeme Augustine. He works in the COVID-19 isolation unit in the University of Benin. Thank you again.
Thank you very much.
At this point, we'll take a break. We have more reports when we return. Don't go away.
Coronavirus special message by our caring individual, Engineer Chris Ogimoyi, FNSE, JP. As Nigerians battle with the coronavirus pandemic, it is necessary for us all to adhere strictly to the guidelines recommended by the federal government of Nigeria and World Health Organization so as to stop the spread of the disease. Stay at home except you are an essential worker. Maintain the social distancing rules. Always wear face masks whenever you want to leave your house. Always cover your mouth and nose with tissue paper whenever you want to sneeze or cough. You can use your elbow when tissue paper or handkerchief is not available. Throw away used tissue paper in the waste bin immediately. Wash your hands with soap and running water and use alcohol-based hand sanitizer regularly. Report any person with symptoms of the disease to authorities concerned. Stay at home. COVID-19 is real. This message is brought to you by an individual with a caring heart. Engineer Chris Ogimoyi, FNSE, JP.
Cancer. There are over 100 different types of cancer. Breast cancer, lung cancer, cervical cancer, and many others. Cancer harms the body when altered cells divide uncontrollably to form lumps called tumors. Anyone is at the risk of getting cancer, but some are more likely at risk because of inherited cancerous gene. Some cancers are sometimes lifestyle-induced, like smoking, lack of exercise, poor diet, chemical emissions, environmental or water pollution may play a role. The chances of having cancer can be reduced by avoiding smoking, using tobacco products and alcohol, eating fresh food, and getting regular exercise. There are some tests and screening to help detect cancerous cells, like mammogram for breast cancer and pap test for cervical cancer, and through other cancer detection tests. Your fighting chance against cancer is early detection and treatment through regular screening and testing. This message is powered by LAPO, improving lives.
Yeah, what though? This coronavirus, everybody they talk, not be play. Anybody fit catch am anywhere and e not they show for face. If you catch am, you fit peme. If person will get a cough or sneeze, anything where the cough touch, if you touch am, come touch your face, or you even go touch another person, you fit don't catch am be that too. Now you make government say make you hear word, make you stay for house, arrange food where you go chop, keep for house. If you dey outside, not shake anybody hand, not they hug anybody. They wash hand every time with soap and water where they flow. Make you wash hand like say you use and touch pepper, come take and clean your face. If water not there, use and sanitize hand. If you dey cough, body dey hot, I not fit breathe. If it be say na coronavirus be that so, make you call this number sharp sharp.
Coronavirus special message by a caring individual, Princess Rosemary Osulatu, founder, Rosula Foundation. As Nigerians battle with the coronavirus pandemic, it is necessary for us all to adhere strictly to the guidelines recommended by the federal government of Nigeria and World Health Organization so as to stop the spread of the disease. Stay at home except you are an essential worker. Maintain the social distancing rules. Always wear face masks whenever you want to leave your house. Always cover your mouth and nose with tissue paper whenever you want to sneeze or cough. You can use your elbow when tissue paper or handkerchief is not available. Throw away used tissue paper in the waste bin immediately. Wash your hands with soap and running water water and use alcohol-based hand sanitizer regularly. Report any person with symptoms of the disease to authorities concerned. Stay at home. COVID-19 is real. This message is brought to you by Princess Rosemary Osulatu, founder, Rosula Foundation. Rosula Foundation wishes you safety during this pandemic. Observe all local and national precautions. The best prevention is staying at home.
Next time you visit the ancient city of Benin, two things will excite you: the warmth and welcome of its people, and of course, the class and style of its hospitality business. Randeki Gold, home of hospitality like no other, located in one of the most serene environments in the ancient city, truly classy and exquisite with world-class facilities, fully equipped digital multipurpose hall with life-size, ultra-high definition LED screen, 180 square meters king-size swimming pool with bubble bath, enough to relieve you breathless. The exotic Ariel's Bistro and Grill restaurant with variety of continental dishes, especially some of the rarest delicacies you can find in town. Fact is, a visit will truly convince you that we are gold. Randeki Gold is the gold wing of the prestigious Randeki Royal Hotel at 6 Henry Street off Ihama and Boundary Roads, GRA Benin City. www.randekihotels.com. Randeki Gold, our hospitality is gold.
Thank you for staying tuned. Edo State House of Assembly has postponed plenary indefinitely. This is contained in a release signed by Clerk of the House Alhaji Audu Omogbai. The statement says, in line with the state government's policy, all officers on grade levels 1 to 12, except those on special duties, are to work from home to curtail spread of the virus. Meanwhile, all visits to the House of Assembly complex are put on hold to further notice, and all honorable members and staff are expected to wear face masks when coming into the complex. An Edo State Chief Judge, Justice Esther Edigin, has ordered the release of 11 inmates from the list of awaiting trial persons at the Nigeria Correctional Service Medium Security Custodial Center, Oko. Elizabeth Omoko reports.
And there is no possibility of tracing any case file for him. In the circumstance, it is my view that the defendant is being held unjustly and is hereby discharged and released unconditionally.
7 out of the 11 released inmates have underlying health conditions. 6 were discharged unconditionally, while 5 were granted bail. Amongst them is the 6-year-old James Enogiru, in custody for alleged kidnap and attempted murder. Also under special cases not listed is Benjamin Simon. He has been in custody since April 2017, but was never charged to court.
The nature is that it has a pus all over his body. The pus dries off. After some time, it comes again. So they know that it affected his liver.
The visit to the center is in line with President Buhari's directive to decongest prisons as the coronavirus pandemic rages.
This is the first of the correctional centers we have visited today, and the criteria was set, and we have followed that criteria, and 11 inmates were released.
For the Controller of Corrections, Nigeria Correctional Service, Edo State Command, Joseph Osendia, the visit is timely.
The congestion is a challenge, and with this and what governor did the other time, we are hopeful that more spaces will be created.
The exercise continues in other correctional centers in the state. In Benin, Elizabeth Omoko, NTA News.
Stay tuned for the concluding segment of the news right after this break.
Coronavirus, also known as COVID-19, is one of the most deadly diseases which has infected over 2 million people in the world right now. The good news is that we can stop the spread if we do the right thing. Wash your hands frequently with soap under running water. Avoid gatherings and physical contact. frequently with soap under running water, avoid gatherings and physical contact, prevent coronavirus by cleaning all surfaces frequently. Returning travelers to Nigeria, stay home and avoid contact with people, including family, for 14 days. For NCDC self-isolation guide, visit covid19.ncdc.gov.ng. My name is Chris Osaiti Neihari, State Public Secretary, PDP, Edo State.
Improved household hygiene is essential to keep your family safe. Did you know that the sodium hypochlorite, the active ingredient in hypo bleach, is equipped to fight viruses and germs? Add some bleach to water, soak a clean napkin in diluted bleach and wipe off germs from common contact surfaces. Wipe off with hypo. Disinfect your home with hypo bleach always.
Endorsed by the Nigerian Medical Association.
Good day, fellow Nigerians.
Stand out.
Normal activities are going on in Ekperi community in Esako Central Local Government Area, despite the confirmation of a COVID-19 positive case in the area. The traditional ruler in the community is worried about the carefree attitude of the people despite regular awareness campaign against the virus. David Irie reports.
Ekperi is a rural community in Esako Central Local Government Area. The people are mainly farmers and they are going about their usual activities. Shops are opened, artisans are busy with their work, and other residents are in clusters, relaxing with little or no attention to the COVID-19 reality on ground. The index case in the community and local government is among the 3 confirmed cases in Edo State last Saturday. The comprehensive health center where the patient was referred to Irua Specialist Hospital has been closed to enable the council officials decontaminate the facility.
The people that he had contact with, you know, everybody is afraid. Nobody will now want to say they had contact with him. Mostly the mosque that is close to their house.
We have to intensify efforts to see that more awareness is created, and now that one is resident with us, I'm sure they are more than convinced now that this thing is real. It's no longer just what you hear on air, but it's right now in our community.
Our house, if you watch out, you don't go anywhere, you don't work. That's what they do.
Despite the awareness campaign in the area, the level of compliance with the safety rules is still very low.
For the closure of this lockdown from the state, now that the governor mentioned 10 days, it's unfortunate that there are still some people, even when the police wanted to effect it, they were beating up at Azukala.
They are still joking with this sickness around this place. When you tell them that he has get to so place, they say Jesus they will not get to us. So now that he has come to Esako Central, let Esako Central to be aware that this thing is on the doorstep. Let them be fully protected and keep distances.
We are worried because we have a family, we have an extended family, that if was with any one of the contacts, everybody in the house, they are not free again.
How do we handle those asymptomatic cases? I was thinking that if there's a mechanism in place whereby at the end of the 40 days period, whether you have symptoms or not, they should be tested before they are allowed to go back to their various communities.
The state and local government officials have already commenced contact tracing of the index case. In Esako Central, David Irie, NTA News.
And that concludes our package tonight. Thank you for watching. Remember, wash your hands regularly or use hand sanitizer. Wear face mask when in public and maintain physical distance. Be safe. Good evening.